Gabby, how
Hello.
you doing? I'm going to be teaching you how to administer oral medication today. If you have any questions, just let me know, okay? Okay, Gabby, so the first thing that you have to do is check that it's the right patient. So the first thing you have to do is just go in there with your chart, check that you've got the right patient, so Gabby Pauletta, and say, hi, how are you? I'm your nurse. I'm going to be giving you your 8 o'clock medication. And just say, can I just double check your name and date of birth? So they would say Gabby Pauletta and your date of birth, okay? The other thing that you need to double check is their name and their hospital ID on their wristband. So you just pull out their wristband and say, hi, I'm just going to check your hospital ID and just double check that with your charting, okay? Alright, Gabby, the second thing that you have to do is check that it's the right medication. So you have a chart and it will say 8 o'clock medication, and today we're using Panamax, so that's what it will say on the chart. So it says 2 paracetamol tablets, so 8 milligrams, which will be 2 tablets, so 4 milligrams per tablet. So you check the medication label, so again we've got Panamax, and also check the order. So we've got the right medication, alright? So Gabby, the third thing that you have to do is check the dose. Check that it's the right dose. So check the order and also confirm the appropriateness of the drug, okay? If necessary, you will have to calculate the drug dose, and also you'll have to check it with another nurse that you have the right dosage, okay?
Sure.
So Gabby, the fourth thing that we have to check is that it's the right route of administration. So again, check the order and the appropriateness of the route ordered. So we're taking Panamax for a headache and orally, okay? And also confirm that the patient can take or receive that medication by that ordered route. So make sure that they're sitting upright and just ask, have you taken this before? And you'll get quite familiar with your patients and know that they're able to take oral medications, but always good to double check, okay? Okay, Gabby, so the fifth thing that you have to check is that the dose is being given at the right time, okay? So check the frequency of the ordered medication with the order chart. Also double check that you're giving the order dose at the correct time, okay? And also confirm when the last dose was given. Alright, any questions so far?
No, I think I'm following.
Alright, cool. Now, Gabby, the sixth thing you have to check is that you're doing the right documentation, okay? So you have to document administration after giving the order medication. So the chart, the time, route, any other specific information as necessary. For example, the site of an injection, but we're doing oral medications now, so you won't have to worry about that. But for future, you need to make sure that you're documenting everything, okay? Gabby, so the other thing that's really important when administering oral medication or any medication is that you're double checking that it's for the right reason. Again, this is so important because if you're unsure what the medication is for and why it is for, it can be quite dangerous. You need to understand the reason and the rationale for the order medication, and also the patient's history with the medication. This is also including any allergies. So does the patient have any history with allergies with this certain medication? So why they're taking the medication, and also revisit the reasons for long-term medication use, and explain to the patient if they need to use this medication further, and go over it with Gabby. The last thing, and probably the most important thing, is that the patient has given the correct and right response to the medication. So make sure that the drug that you're given led to the desired effect. So in this instance, we have given 2 tablets of Panamax, okay, so 8 milligrams, and the desired effect is to get rid of any headaches. The patient has been complaining of a headache, so she'd like to get rid of that headache, okay? So for another example was if you're giving an antihypertensive, make sure that the blood has come down and just make sure that the drug is doing what it needs to. And if not, you're going to have to go over that dosage order and maybe, consult the doctor and double check. And that's why it's so important, because the drug needs to be doing what it needs to do. Okay? Do you have any questions about the right response or anything?
What if a patient can't take a tablet?
So that's what I was saying before, is that you need to make sure that the patient can take the tablet. So you go in there and you just say, we're taking Panamax, is this okay? And make sure the patient is sitting upright, you're not having the patient lying down. Just make sure that the patient can take the tablet, make sure the patient's sitting upright, and just say, this is what I'm giving you at this time, and they will usually be okay with that, or if they're not, they will let you know, and you can record that and go and consult the doctor as well, okay? Okay, Gabby, the easiest way to give a patient their oral medication is to prepare them a glass of water, and we will give that to them prior to administering the medication, and just make sure you sit with them and make sure that it goes down well and that they've taken the medication correctly, okay?
Yeah, no worries.
Okay, Gabby, so do you know how to administer oral medication safely and effectively?
Yeah, so pretty much you just have to go through the 8 steps of administering medication. So checking that you've got the right patient by checking their tag. You have to ensure that you have the correct medication
Correct.
that's been prescribed to them. That you've got the right dose by calculating the dose that is required. You also then need to check the route, the time, and the documentation. Look at their history, what is actually wrong with them, why they require the drug.
Correct.
And then that the drug is appropriate and necessary for what they are using it for. And then finally to go back and double check with the patient to make sure that they have responded well to the drug and that is doing what it's supposed to be doing.
Yeah. And I was just wondering, how would you give the medication to the patient?
Well, if they're taking it orally, like a tablet or a capsule, you would to the patient with a glass of water so that they can easily swallow it.
Yeah, and what position should the patient be in?
The patient should be sitting or standing upright so that nothing is obstructing their esophagus as they
Take the capsule.
digest.
But awesome, good work.
Thank you. Thanks so much for teaching me.
Okay, Gabby, I've shown you the 8 rights on how to administer medication. Do you have any questions at all anymore about?
No, I think I'm all good.
No worries.
Yeah, you've been really helpful. Thank you.
Okay, cool, no worries. Good luck with everything.